This is rural Bihar, a large state of 100 million people in North India on the border of Nepal. If you're sick, it's almost impossible to be seen by a trained doctor here. Health facilities are basic. This one advertises treatments for things like infections, STDs, infertility, TB, and menstrual problems. Most medical facilities in rural Bihar are run by people with no formal medical training, and many children die from things that are actually easy and cheap to treat. The people of Bihar have been at the center of what some believed could revolutionize healthcare for developing countries. It's called telemedicine, and the idea is this. Healthcare providers in urban centers like New Delhi would connect via high-speed internet with rural healthcare providers. Providers in Bihar would get equipment and be trained as facilitators, so doctors in New Delhi could talk to patients directly, remotely monitor their vital signs, that sort of thing. The idea was to create a large network of providers in Bihar, essentially franchises like fast food, but for healthcare. The project launched with $23 million from the Gates Foundation and other sources, and was aimed to drastically improve the rates of appropriate case management and treatment of childhood illness. It was run by a group called the World Health Partners. It got a lot of good press, and it seemed promising. But when researchers from Duke, Stanford, and University College London came to Bihar to evaluate the World Health Partners program, the data showed a different story. When team members headed into the community to talk to people, they asked questions like, "Have your children been sick with diarrhea recently? And how did you deal with the illness?" It turns out the telemedicine project did not improve health outcomes for people in Bihar at all. Think of it this way. Before the study in Bihar, lots of sick children weren't getting the right treatment. And then the World Health Partners intervention happened, and it looked like the telemedicine project was having an impact, and that a lot of kids were getting the right treatment. But if you look at other communities in Bihar where the program was not implemented, it turns out that similar changes were happening without any intervention at all. Ultimately, the World Health Partners project didn't make much difference. It had no effect at all on improving the rates of children being treated correctly for diarrhea and pneumonia.
I think going forward, both donors and NGOs would probably want to get credible evidence that, yes, if I introduce a technology, there will be demand for the technology, understand who's going to adopt it. And then a central key question that still remains unanswered is, do patients really respond in terms of demand for healthcare based on quality? Do they observe that, yes, you are providing better quality today than I am as a healthcare provider, and therefore they choose to come to you? We don't know that yet.
What matters in any project, say researchers, is not how much you do, but how much of a difference you make.